I stood at the entrance of the ICU, a place I had called my second home for years. It was a typical day, or so I thought. But as the sliding doors opened, a wave of panic washed over me. The familiar hum of beeping machines and hushed conversations had been replaced by chaos and urgency. The ICU was flooded with COVID-19 patients. We had prepared for this scenario, but nothing could have prepared me for the sheer number of patients that had arrived in such a short time. My heart raced as I realized the gravity of the situation. The COVID-19 pandemic had taken a devastating turn in our community, and our ICU was overwhelmed. Nurses and doctors scurried around, donning their protective gear and tending to the critically ill patients. But it was clear that our existing protocols were no longer sufficient. We needed a plan, and fast. I gathered the team of nurses and doctors at the nursing station. The anxiety in their eyes mirrored my own. We couldn't afford to make mistakes. These patients needed us now more than ever. I took a deep breath and began to outline a new ward management plan. The goal was clear: provide the best possible care for our patients while ensuring the safety of our staff. It was a daunting task, but there was no other option. First, we divided the ICU into zones, separating COVID-19 positive patients from those awaiting test results. We designated specific teams for each zone, ensuring that each had the necessary equipment and supplies. This would minimize the risk of cross-contamination. Next, we implemented strict protocols for donning and doffing personal protective equipment, PPE. It was crucial to protect ourselves while caring for the sick. We practiced the proper techniques until they became second nature. Communication was key. We established a central command post where all critical information was relayed. This streamlined decision-making and prevented confusion. We also created a schedule for regular check-ins to ensure everyone was coping emotionally and physically. Our pharmacy team worked tirelessly to manage the medication supply, ensuring that we had enough of the vital drugs needed to treat COVID-19 patients. We had to be prepared for any eventuality. As the hours turned into days, our new plan started to show promise. It wasn't perfect, and we faced challenges, but we were learning and adapting. We had a singular focus: saving lives. The sound of ventilators and monitors became a constant backdrop to our lives. But amidst the chaos, there were moments of hope. Patients who had been on the brink of death began to stabilize and improve. Their recoveries fueled our determination to keep going. The support from the community was overwhelming. People dropped off supplies, sent us encouraging messages, and clapped from their balconies in the evenings. It was a reminder that we were not alone in this battle. Weeks turned into months, and our new ward management plan became ingrained in our daily routine. We were still facing challenges, but we were managing. The influx of patients began to slow, and hope started to replace despair. Looking back on those challenging days, I'm filled with a sense of pride and gratitude. We had faced an unexpected and overwhelming crisis, but we had come together as a team and devised a plan that saved lives. It was a testament to the resilience and dedication of healthcare professionals everywhere. As I stand at the entrance of the ICU once again, I know that the battle is not over. But I also know that we are better prepared than ever, thanks to the lessons we learned during that unexpected influx of COVID-19 patients. We will continue to adapt, to learn, and to fight for the health and well-being of our community, no matter what challenges lie ahead.